Hi, I'm Spencer.
And I'm Jessica, and we are doing our YouTube video on refugees and how they are affected by the healthcare system.
Hi, I'm Biren Dulal, a Bhutanese refugee from Nepal. Here I just wanted to tell a few things about how refugees access their Medicaid, the health insurance. To say about that, I just wanted to express my own experiences here. After I came here, I applied for the Medicaid with the help of my brother, which I got, and I used it for a couple of medical appointments and a few immunization, but before I complete my immunization, the date expired and I didn't get that again. So I had to apply for the next health benefit, and I applied for PCN. They provided me the PCN, and I was able to track my immunization and other medical appointments. And now I'm employed and I have the insurance from my employer.
Okay, Jessica, how do individuals in your chosen population access healthcare?
Refugees, when they come here, they sign up for Medicaid, and they get that for the first 8 months.
And explain how access is either available or restricted.
It's available in that the Refugee Resettlement Agency will help them coordinate appointments through their Medicaid, but it's restricted in that Medicaid is only for 8 months, so there's a time restriction, and Medicaid will only cover certain things, so there's another restriction.
And what is their method of payment?
So refugees don't have to pay. It's Medicaid is paid for by the government for the first 8 months.
And does their method of payment restrict their ability to access healthcare?
Well, it doesn't if everything that they need falls under their plan. But if a refugee needs something that is outside of what Medicaid covers, then the refugee has to pay out of pocket, or they just don't receive the services if they can't afford it.
And what types of choices do they have in selecting providers of healthcare?
Actually, pretty okay. Refugees get to choose their own HMO or health maintenance organization, and then the Refugee Resettlement Agency will help them choose providers that are refugee friendly, but they also have limited choices within Medicaid of who Medicaid providers are. So Spencer, does this population have difficulty finding healthcare providers who will accept them as clients?
Yes and no. The thing that gets frustrated with providers is having the translators available, and also just the communication. So there may be some skewed, just conversation and communication wise is the hardest thing. And then another thing that's really hard is the them coming in and not knowing about being timely and being late for appointments is the kind of the key things.
Okay. Are there specialized services that are targeted to the specific needs of this population?
Yes, there's the State Office of Refugee Services that's funded, that's available to them for 6 months of free dental care. There's also the health screening within a first 30-day agreement with the refugee, and that's available through the federal government. And there's also another program that's called the Latent Tuberculosis Infection Program that provides pills for adults 6 months, and then also with children for 9 months. And this has kind of been a positive impact with them, especially helping the refugee be empowered and to make decisions and choices for them.
Oh, good. And what overall, is the health of this group negatively affected by the current healthcare system?
No, not necessarily. The only thing that's there's not been a negative with the healthcare system, but it is negative comes from the strict restrictions in federal funding. And there's no other options except for after the 8 months of Medicaid. So that's kind of hard. They have to find other alternatives.
Okay, well, thank you so much.